So today we're going to talk about inserting an indwelling catheter on a female patient. So first things first, you want to verify that you have the order for the indwelling catheter. You never need to place an indwelling catheter without an order because it is considered an invasive procedure. So you will gather all your supplies that you need for the procedure, which would really just be the Foley catheter kit. You will introduce yourself to the patient when you walk into the room. Hi, my name is Jordan. I'm going to be your nurse today. You would provide privacy to the patient, whether that's asking family members to step out or pulling the curtain, whatever that is. Verify the name and date of birth with the patient to ensure you're placing the catheter on the correct patient. You will then explain the procedure to the patient. So we're placing this catheter today, Miss So-and-so, for urinary retention, for surgery, whatever the case shall be. Let them know what an indwelling catheter is. It's to drain your bladder in the event that you are unable to do so. So you explain that to them. You want to verify patient allergies. Two reasons being, your kit most times will have a latex Foley, and it will also have betadine, two very common allergies. So you want to make sure that your patient is not allergic to either one of those. So your next step will be just kind of placing your things on your bedside table. I'm not gonna put a catheter in or anything because I don't have anyone to do it on, so I'm just gonna kind of talk through what that would look like. So place your things on the bedside table. You would assist your patient into the position for Foley placement, which would be with their feet kind of butterflied together, their feet together with their knees apart, just kind of relaxed out to the side. So you would apply clean gloves and perform perineal care where needed. Just make sure the patient's good and clean before the procedure. You would then take those gloves off after you performed your peri-care. You would clean your hands, and at this point, using sterile technique, you're going to get your equipment ready, and after that, you will put on your sterile gloves. So you want to open this away from you. You don't want to come towards you first. You'll have some fun little things in here. If you are placing this on a male patient, this is for your male patient. This is a peri-care wipe if you need this for your peri-care. Be sure that you're just touching the outer edges of this because the outer edges are not considered sterile, but the inside of it is. So at this point, before you flip this last flap over, you can get your own sterile gloves, or the pack has a pair of sterile gloves that you can put on at this point. And then you would pull back. Here's one more little hand sanitizer wipe if you need it. Then you would pull this one back. So then your kit is ready. So we're gonna imagine that I have taken these gloves off. My sterile gloves are on at this point. Your sterile gloves are on. I like to set my kit up first, but to each their own. You never blow up the balloon before putting in the Foley, but what I like to do so you're prepared is I like to take the saline syringe and just go ahead and hook it up to the port. The next thing that is very beneficial is to go ahead and open up your lubricant, put it into your tray, and then be sure that this doesn't touch anything, but take the clear cover off of your Foley, off of your catheter, and place it into the lubricant. And you would just drop that into the trash. Last thing I would do before I get ready to touch the patient is I would open your iodine packets. You would peel these like this. You can pull these out, set them in your tray, and then this would be considered trash. You would drop that off to the side. With your non-dominant hand, you would spread the labia to expose the meatus. You would take your first iodine swab and swab down the middle. You would then take your second iodine swab, swab to the left, and your third iodine swab and swab to the right. At this point, the patient is clean. This hand is still sterile. This is your dirty hand. You would then grab your catheter with the lubricated tip. You would insert the catheter until you get to a point where you have urine return in the tube. Once you have urine return, you would advance just a little bit farther. Once you get to that point, they say about 2 inches. Once you get to that point, it's now time for you to blow up your balloon. So you can hold this with this hand, blow up your balloon. Perfect. Blow up your balloon. Obviously this will be on the inside, so you won't see it. So you will kind of pull this very gently just to test and make sure there's a little bit of resistance. Once you meet that resistance, you will attach it to their leg with a stat lock, which will be in your kit. So this will be on the inside. You will attach it with your stat lock. At this point, we are done. The catheter is in. You can take off your sterile gloves at this point, or you can continue to use them as just gloves. You would take this part off. This just so you can see what's in the bag. You will help the patient back to a position, clean the patient up, get all of your trash out of the way. Most importantly, make sure that this bag is hanging below the bladder. You do not want it above, you do not want it at, it will not drain correctly. Once all that is done, you can reassure the patient everything went well, check on them, make sure they feel okay, and then your last thing is to document. So you need to document the type of catheter, the size of the catheter, the amount of fluid inserted, which in most cases will be 10 cc's, 10 mLs, but just check that that's what is in your syringe. The tolerance of the patient to the procedure, as well as your name, the time and date that the catheter was placed. And that is it.